I'm going to introduce the audience right now. I'm the first audience member, the cameraman behind the camera. There's 1, 2, 3, and 4. This is Irma La De Rosa's last speech for this class. Good luck, Irma. Take it away.
Good afternoon, ladies and gentlemen. My name is Irma La De Rosa. Today I'm going to talk to you about becoming a phlebotomist, the proper techniques to draw blood, and various techniques that are used. Let us start with the definition from the website medicinenet.com. Obtaining blood from the vein. In the old days, this was done by cutting a vein and just letting the blood flow into a container. Today's phlebotomist is done more neatly by puncturing a vein with a needle. Being a phlebotomist, myself, I can tell you the definition is quite simplistic. There are many factors that must be calculated before drawing the blood. How to become a phlebotomist? Step 1. Becoming a phlebotomist is getting your high school diploma or equivalent. The second step is choosing training program like El Paso Community College, who offers a 120-hour training course to become a phlebotomy technician clinical. Step 3, become certified and completing an education program. Students can choose to become certified professionals. Certifications are available from the American Society of Clinical Pathologists, American Medical Technologists, or the American Association of Medical Personnel. Step 4, and the most important, obtain employment. Now that we know how to become a phlebotomist, let us examine some of the tubes or to draw blood safely and properly. Tubes are in 9 basic colors, as you can see. I'm holding light blue with the additive 3.2 sodium creatinine, which is used for testing how well the blood coagulates. Red, gold, and tiger stripe sometimes have a clotting additive. Gel and is used mainly for chemistry, serology, immunology. Green with the additive sodium or lithium heparin with or without gel is used to test a stat routine chemistry. Lavender pink or blue with the additive potassium EDTA is used for hematology and blood bank. Gray with the additive sodium fluoride and sodium or potassium oxalate that is used to test glucose, especially when testing will be delayed. Blood alcohol, lactic acid is important for you as a phlebotomist to know the colors and what they are used for the order of draw. Let us move to a different type of needle. Needles that are needed to draw blood. The reason they are needed for different sizes of needles is because there are different sizes of people and different ages. I'm holding what is called a butterfly or a wing-infused needle. This is primarily used for infants and young children, but can be used on adults that have small veins that are hard to draw from. Needles come in various gauges, meaning size starting from 32 gauge and going down to 6 gauge. The higher the number or gauge, the smaller the needle. Gauge 32 is the most common used on infants, and gauge 6 would be used to blood banks, and most common gauges 27 and 26. Now that we have learned a little about some of the equipment needed to draw blood, let us get to a main point of this speech: how to draw blood. There are steps that needed to be followed, and they are as follows. Make sure you have all your supplies, needles, tourniquets, alcohol wipes, gloves, Band-Aids, sterile gauze, tubes to collect the blood, bag to put the blood filled to, and if needed, to transfer device and syringe, butterfly needle, and orders that what tests are being done. Introduce yourself and make sure that the patient's identity is by checking birthday and name. Put on gloves, check both arms to see which one will be the best for drawing, and apply tourniquet to the arm above the elbow. Check for veins in a pressurized arm. The vein should feel like a trampoline bouncing back at you. Clean the puncture area with alcohol pad for about 15 to 20 seconds. Use a needle to puncture the vein. Once the vein is good, blood flow into the collection to remove the tourniquet to allow steady blood flow. Once the collection is finished, remove the needle and immediately cap it. Make sure to apply appropriate labels to all collected. Last but not least, make sure that you clean up used materials, dispose of them in a proper biohazard container. If you follow these steps, you should have no issues collecting the specimens. This concludes my lecture of how to become a phlebotomist and how to draw blood. There are many other things that I could talk to you about, like other jobs that a phlebotomist does, such as collecting urine, stool, and breath samples. However, with a limited time I have to speak, I had to keep my speech short. I hope what information I was able to provide was informative and helpful to you. I thank you for coming and have a good day.
All right, and I'm going to show the audience once again. Clap, guys. And I'm the fifth one behind the thing, and there's Irma one last time. Have a nice